Every medication can be administered through various means, known as routes of administration, and various schedules, meaning at particular frequency and amount or dose, which is known as the dosing regimen. Alright, so routes of administration are broken down into three main categories: enteral, parenteral, and topical. In enteral administration, which is the most common form, the medication is administered through the gastrointestinal tract. This could mean that it's swallowed by the mouth, also known as peroral administration, placed under the tongue, also known as sublingual administration, between the gums and the inner lining of the cheek, also known as buccal administration, or finally into the rectum, also known as rectal administration. Parenteral administration includes any route that bypasses the gastrointestinal tract to pump the medication directly into the circulation, such as through an injection into a vein, intravenously or IV for short, under the skin, subcutaneously or SC for short, or into muscle, intramuscularly or IM for short. Finally, there's topical administration, where the medication is applied directly upon a particular area of the skin or mucous membrane to achieve a local effect. For example, antifungal creams to treat athlete's foot. Now, choosing the route of administration depends on many factors. First of all, these include the chemical properties of the medication itself, such as its stability and its ability to cross certain barriers of absorption. For example, a perorally administered medication needs to be able to resist tough, acidic conditions within the stomach, and then readily pass through the walls of the intestine into the blood. In addition to this, blood coming from the gastrointestinal tract is first directed to the liver. And that's where many medications get broken down or metabolized before gaining their entry ticket to the systemic circulation. This means that medications are metabolized before they even get a chance to reach their target tissues. This is known as first-pass metabolism, or the first-pass effect. So, medications that get extensively metabolized into inactive forms through the first pass shouldn't be administered perorally. In contrast, IV administration allows medications that are less stable or less capable of being absorbed through the gastrointestinal tract to be directly administered into the bloodstream, which is also beneficial for medications that have a major first-pass effect. Next, another factor that should be taken into account is the urgency of the situation. So, for example, peroral medications take time to get absorbed in the GI tract, so they produce an effect much more slowly than intravenous ones. And for this reason, intravenous administration is usually preferred in emergency settings and during surgical procedures. On the flip side, oral preparations are much easier to take at home, and they don't need any special equipment. Alright, now each medication is given at a specific schedule or dosing regimen, which determines the frequency of administration and the amount administered, known as the dose. The regimen is important since it affects the onset of action, or the time it takes for a medication to start working and produce an effect, as well as the duration of action, which is the total length of time during which a medication produces an effect. So, there are three main types of dosing regimens. First, there's single dosing, meaning that only one dose of a medication is administered. Let's plot this onto a graph with the drug concentration in plasma on the y-axis and the time on the x-axis. So the plasma concentration of the medication rises steadily as it gets absorbed into the circulation, until it reaches a peak. Then the concentration drops again as the medication is distributed into tissues, gets metabolized, or is eliminated. Next, there's a regimen of continuous infusion. This is when a medication is infused intravenously at a constant rate. And in this case, the plasma concentration progressively rises and reaches a peak, but instead of falling off, it continues at a plateau, also known as a steady state. The reason why this happens is that as the concentration of the medication increases, so does the rate of elimination. And the rate of elimination will keep rising until it becomes equal to the rate of infusion. So, the steady state is when the rate of infusion equals the rate of elimination. Now, the time required to reach the state is determined by the half-life of the drug, which is the time needed for the plasma concentration of a medication to be reduced by half, or 50%. So it usually takes 4 to 5 half-lives to reach steady state. On the other hand, the concentration of the medication at the steady state depends on the infusion rate. So increasing the rate of infusion will lead to a higher steady state plasma concentration. Finally, there's an intermittent dosing regimen. This means that a certain dose of medication is administered at regular time intervals through a given route. If the next dose of a medication is administered before the previous dose has been completely eliminated, the plasma concentration will once again progressively rise. In this case, though, it will fluctuate between peaks and troughs. And the rate of elimination will increase along as well, until it matches the rate of administration. That is when the amount of medication lost in each interval equals the amount gained by administration, so that the average concentration of the medication reaches a plateau or steady state. Just like in continuous infusion, the steady state is usually reached after 4 or 5 half-lives, and the concentration of the medication at the steady state depends on the frequency of administration. Now, in some cases, like in life-threatening situations, the steady-state plasma concentration has to be reached more rapidly. To accomplish this, we can administer a loading dose. That's a large dose given at the beginning of a treatment course to rapidly reach the peak plasma concentration. The loading dose is then dropped down to lower maintenance doses, which maintain the steady-state plasma concentration. Alright, as a quick recap. Routes of administration include enteral routes like oral, sublingual, buccal, and rectal administration, parenteral routes like intramuscular, subcutaneous, and intravenous administration, and topical or local administration. The choice between them mainly depends on the properties of the medication and the setting in which it's used. Dosing regimens determine the frequency and dosage of the medication, which include single dosing, continuous infusion, and intermittent dosing regimens.